Hi friends, welcome back to my channel. Yesterday during my another video I told you that after our registration with the NMC they will send a mail can do the test of competence, that is the CBT. CBT means computer based test only. It is like multiple choice questions you can answer, but by practice without any training from any institution you can clear that exam. So just there are some materials I will provide some here, so just practice and with the rationale, so it will be easy for you. And there will be 15 questions of the calculation, the part A, that will be the same as in the Pearson view. The site there is some mock test, so it will be the same. So here I am going to give some other examples. Just try to go through this video and practice it. So here is the first question. What are the steps of the nursing process? We are studying during our school days. The first, assessing, diagnosing, planning, implementing and evaluating. B, assessing, planning, implementing, evaluating and documenting. C, assessing, observing, diagnosing, planning and evaluating. D, assessing, reacting, implementing, planning and evaluating. So what do you think? Which is the right answer? So I am going to give the answer with the rationale. So the answer is A, assessing, diagnosing, planning, implementing and evaluating. That is the steps of our nursing process. So let's move on to the second question. Second question, what is clinical benchmarking? A, the practice of being humble enough to admit that someone else is better at something and being wise enough to try to learn how to match and even surpass them at it. B, a systematic process in which current practice and care are compared to and amended to attain best practice and care. C, a system that provides a structured approach for realistic and supportive practice development. D, all of the above. So what do you think? The answer, ultimate clinical benchmarking, that is the criteria we have to attain. The right answer is D, all of the above. The clinical benchmarking means it consists of all of these things. The reference is given, you can read from there. Question number 3 is, it's an easy one. What is nocturia? A, urinary frequency, urination at night, poor urine output, and D, non-passage of urine. As a nurse, we all know this is a urination at night. So here is the explanation. Nocturia is urination at night. It often increases with age. It's normal to get up twice at night from the age of 70 onwards, but more frequent visits to the toilet may indicate a problem that can be treated. So the rationale is mentioned there. The fourth question also a simple question. What is the name given to a decreased pulse rate or heart rate? Tachycardia, hypotension, bradycardia, anti-arrhythmia. It is an easy one, so we all know that is bradycardia. Let's move on to the fifth question. How do we handle a specimen container labeled with a yellow hazard sticker? A, wear gloves and apron and inform the laboratory that you are sending the specimen. B, wear gloves and apron, mark it high risk and send the specimen to the laboratory with your other specimens. C, wear gloves and apron, inform the infection control team and complete a DATEX form. D, wear a gloves and apron, place specimen in a blue bag and complete a DATEX form. So which is the right option? Let's see. DATEX form means that is like incident reporting only, the risk management system they are using in the NHS. So the answer option is A, wear gloves and apron and inform the laboratory that you are sending the specimen. The reason is given below. You can just pause and read and learn it. Check the question 6. To whom should you delegate a task? A, someone who you trust. B, someone who is competent. C, someone who you work with regularly. D. All of the above. So I think no need to check the answer option itself. We can decide because usually we do not, even though we are close friends, we should not trust anyone blindly. They can make mistake, and who is competent means they know everything. So the answer will be the competent. And even though you work with them regularly, it doesn't mean they are perfect and they will not make any mistake. So the answer will be the person who is competent. Let's see the option. So our answer is correct. B. Someone who is competent. Seventh question is, where is revision on the nursing process done? During A. Diagnosis, B. Planning, C. Implementation, D. Evaluation. They are asking in which phase you can do some revision. So let's see the option. So the answer for question 7 is D. Evaluation. So the reason is given, just try to read and familiarize it. Question 8 is, why are support stockings used? A. To aid mobility, B. To promote arterial flow, C. To aid muscle strength, and D. To promote venous flow. Let's go to the answer option. So here the answer is to D. To promote venous flow. Why I am not reading the rationale means the video will be lengthy and you may not be interested to go through it. Okay, so just read by yourself. So the 9th question is, how do you test the placement of an enteral tube? Enteral tube means we are using for the enteral feeding the nasogastric tube. So A. Monitoring bubbling at the end of the tube. B. Testing the acidity or alkalinity of the aspirate using blue litmus paper. C. Interpreting absence of respiratory distress as an indicator of correct positioning. D. Have an abdominal X-ray. Usually after insertion we will confirm through the abdominal X-ray. But thereafter, before each feeding or something like that, or the starting of our endos, the shift, usually we check with the litmus paper. So, option B is the right answer, testing the acidity or alkalinity of aspirate using blue litmus paper. And they are mentioning it should be between 1 and 5.5. If it's more than 5.5, we should not give medication or start feeding. But there are some exceptions, like the patient is on continuous feeding or patient is getting proton pump inhibitor like the omeprazole or something like it can affect. So we should keep at least 30 minutes like that NBO or keep the feeding off for some time. Then only it will give the correct level. Let's see the last question. Question 10. What is meant by an advocate? Is it a lawyer? We have heard that they always work as an advocate for my patient or patient advocate. So let's see. A. Someone who develops opportunities for the patient. B. Someone who has the same beliefs as the patient. C. Someone who does something on behalf of the patient. And D. Someone who has the same values as the patient. So let's see the option. So the answer is C. Someone who does something on behalf of the patient. For example, especially those patients are in the ICU, they cannot speak for themselves. So we should understand their concern and we should speak for them. So that is the thing. I think it's clear for you. If you need more videos, please comment below the comment box. I will update. Thank you.